family, and friends. The month of February is Heart Health Awareness Month. Heart disease is the leading cause of death for both men and women across most racial and ethnic groups in the United States. Heart disease, also known as cardiovascular disease, includes conditions such as coronary artery disease, heart failure, atrial fibrillation, and stroke. Together, these conditions account for the most common causes of death in the U.S., with coronary artery disease leading the pack, followed by stroke. What is particularly concerning is that the prevalence of heart disease and related deaths has begun to rise again and is expected to continue increasing. According to the CDC, in 2021, approximately 697,000 people died from heart disease. In 2022, that number increased to 702,880 deaths, which equates to nearly 2,000 deaths every day. Put another way, one person dies from heart disease every 33 to 34 seconds. From 2017 to 2020, approximately 49% of U.S. adults had some form of cardiovascular disease, and the burden is even higher among certain populations. About 59% of African American adults have some form of cardiovascular disease. The average age of a first heart attack is approximately 65.6 years for men and 72 years for women. Let's take a closer look at coronary artery disease. Coronary artery disease occurs when the coronary arteries, which supply blood, oxygen, and nutrients to the heart, become damaged and are unable to deliver an adequate blood supply to the heart. This damage is caused by atherosclerosis, which is the buildup of plaque inside the arteries. Plaque is made up of cholesterol, fatty substances, calcium, inflammatory cells, and other waste products. Over time, plaque buildup causes arteries to narrow and stiffen, limiting blood flow to the heart. When the heart muscle does not receive enough oxygen-rich blood, it can cause chest pain or discomfort known as angina. A heart attack typically occurs when a plaque within a coronary artery ruptures, triggering the formation of a blood clot that suddenly blocks blood flow to the heart muscle. This interruption in blood flow can result in permanent heart damage or even death. At this point, I would like to show a visual aid. So here we see progression from number 1, a nice clean artery with no plaque, to number 4, an artery full of plaque, and it's severely narrowed. This artery full of plaque makes it extremely difficult for blood carrying oxygen and nutrients to supply the heart. This, combined with the risk of plaque rupture and sudden clot formation, creates the perfect conditions for a heart attack. And this is exactly what we want to prevent. Well, that's it for today. See you next week.